we've had this year over 700 people come to us. Most of them actually have mild depression or anxiety. Most people are just saying, hey, I've noticed I don't feel myself. What can I do to feel better? I see people coming in at their worst and I see them 6 months later, a different person, changed. Some of them come back because mental health is a journey. Sometimes you feel good, the next day you feel bad. So we always say you've got to work on it every single day. I had a health scare. I fell down the stairs and broke 3 bones in my back, and it made me realise I don't want to die because I'm a workaholic at a hospital. I want to die potentially as a workaholic in the community.
G'day, Shirley-Anne. Thank you so much for coming in.
Oh, it's a pleasure. Thank you for having me.
So, you're from Momentum Mental Health here in the Darling Downs?
Yes, yes.
Would you like to open up with telling us all about Momentum Mental Health?
Yeah, sure. So Momentum actually has been around for 25 years, but we used to be called Toowoomba Clubhouse, and we had a drop-in model. And then we realised in 2021, before I started, we realised that that wasn't actually what people needed. To work on your wellbeing and your mental health, it's better to have a more structured program where you can work on your wellbeing with goals and have a wellbeing coach and stay for 3 to 6 months or a year if you need to. And because people live in the community, they don't live at Momentum. And so we changed our model to one of prevention, and it was focused on what we call the 5 ways to wellbeing, because wellbeing is not about your physical wellbeing or just your mental wellbeing. It's about your connections, your social wellbeing, spiritual wellbeing, physical wellbeing as well. It's all in one. Yeah, that's how we moved to that.
Lovely. So you guys have been established for quite some time, like you mentioned.
Yeah.
Society as a whole over the last probably 5 to 10 years has done a good job of moving this stuff more into the light, where mental health and these discussions are becoming more and more prevalent in day-to-day conversations. What are you guys noticing on the ground in the sense of requirements for needs and the amount of people that are coming in and utilising your service?
Well, I certainly have noticed that you hear a lot more about mental health and particularly wellbeing, which I love because that's a bit more holistic.
Yeah.
But you'll hear comedians talk about this new generation having anxiety, and I just think it's great people are talking more, because this is not new, but people used to keep it very hidden, and it was a topic people actually were quite embarrassed to talk about, saying they had depression or anxiety. Now people are really more self-aware, which is so exciting for us because we have a lot of people. We've had this year over 700 people come to us. Most of them actually have mild depression or anxiety. Not that many people actually have a mental health condition that they need our support if they're not on medication, for example. Most people are just saying, hey, I've noticed I don't feel myself. What can I do to feel better? So it's not more people with mental health necessarily, more people coming forward to acknowledge they don't feel quite right.
That's incredible.
Yeah.
That's incredible. So how do you get your name out there in the community to be able to impact 700 lives this year alone?
Oh, well, it's funny because last year we actually added up how many community events we went to, and we went to 136 community events.
Goodness.
And we counted the number of people that were at those events, and we impacted 16,000 people with our message. This year, so far, financial year to date, we've gone to 90 events. So it's a lot of getting out there and sharing your name.
Yeah.
But what I love about going to the community events, we see the same people, and we see organisations that also see the same people. And what I mean by that is you may be in a housing and homelessness organisation that supports people with housing. Guaranteed they'll have a mental health condition or poor wellbeing, so we see them as well. Or they might be in a domestic violence situation, we see them. So we share the same clientele, and it's really nice to get out in the community, see people in their everyday lives, but be able to share the message that it's okay to not be okay. And the best thing you can do is when you don't feel yourself, can come to organisations such as Momentum, and we're 100% free, and I'm really proud of that.
What an incredible service.
Yeah.
So to be able to service 700 people, go to the 90-odd events over this financial year, what does your team look like?
Oh, it's very tiny. We're in 7 locations, but we have a total of 14 people. It's really small, and it's quite funny. I used to run Toowoomba Hospital, and I ran it for 7 years, and I had 4,000 staff. So going from 4,000 to 14, or 13 excluding me,
HR would be easier.
Crazy. Yeah. Actually, it's funny because I thought I'd be quieter, and yet it's more busy, or just as busy as running a hospital, because you don't have an assistant, so you are the HR person, the data person, and that you don't have this big crew of people to help you. But it's the most rewarding job I've ever had. And it's just amazing because I see people coming in at their worst and I see them 6 months later a different person, changed, not because we do anything extra special. Well, we do have amazing wellbeing coaches, but people realise those skills themselves to get better. And I love it when people identify, I'm not feeling right, how can you help me? And our wellbeing coaches work beside them to get them into a job or refer them to others. And you see these people that might not have worked for a really long time suddenly employed, and they're so proud of themselves.
Yeah.
And our team, we know most people by name, so they come in and it's like, oh, hey, John, hey, Sarah, whatever like that. And it's really cool because they become our family. And when you see them uptown, I love it that most people aren't ashamed of coming to us. So when they see us, we won't say, oh, hey, I'm from Momentum, great to see you. It'll be, hey, how are you? Because they are like friends. Yeah. And that's, I think, the most exciting thing for me. You can notice the impact you make. And I didn't notice that at the hospital so much. I was too high up in a position to know the people on the ground, and they didn't stay for, it was a different environment. Whereas these people, you get to know them over months and you see them improve. Some of them come back because mental health is a journey. Sometimes you feel good, the next day you feel bad. So we always say it's mental health and wellbeing for everyone every single day, because you've got to work on it every single day. But some really great news stories of people getting on with their lives.
That is fantastic.
Yeah.
Now, just from the few things you've mentioned, it sounds like you've got an incredible bandwidth to take on hard things. So both emotionally and in your professional life, by the sounds of it, going from the Toowoomba Hospital to Momentum Mental Health, it's that heart of serving and heart for people, obviously.
Yeah.
Well, what would lead you to do that? I know for me, that would tear me up. But you also get that so fantastic experience of joy at the end when you see that transformation.
Yeah.
What's your conviction there? Why?
It's funny because when I was young, I had teenage parents and we had no money. And so my goal in life was to be a millionaire. And I wanted to be really, really super rich. So when I went to university, and I was the first one in my family to go to university, I studied finance.
Yep.
See, finance, make lots of money. And but it wasn't until, and because we had no money, I didn't go on any overseas trips. And then when I was at the university, I went on a pub crawl around America as part of my uni. And it was the first time I'd been on a big plane. And we stopped off in Fiji. And I noticed the difference between the amazing resort we were staying at and the people that were actually living in Fiji, and the difference in the socioeconomic status. And it made me think, oh my gosh, I don't know that I want to be a millionaire when I see how people actually live. And so I went back to uni and I did a double degree, and I did an honours degree in social anthropology, which is a study of people and cultures. And that's when I realised this thing called the social determinants of health. And what it essentially means is you can be born into poverty, and often only 70% of people remain there, only 30% climb up to middle rung, and then only 5% go up to the highest rung of the ladder, because you don't know what you don't know. And I, reflecting on my childhood, where my parents they didn't know what they didn't know about education so much, so I could have easily stayed down in that bottom rung of the ladder. And so that's got me involved into health, which got me involved into working at a hospital in New Zealand, and then I suddenly climbed my way up and then came over here. And running the hospital, it made me realise I get to deal with, at a public hospital, people that can't afford necessarily to pay, which tied in with my values, which is I'm very much supporting people who are vulnerable. But I had a health scare. I fell down the stairs and broke 3 bones in my back, and it made me realise I don't want to die because I'm a workaholic at a hospital. I want to die potentially as a workaholic in the community. And so that's why the job of CEO of Momentum came up, and I was like, I want to give back at that level.
What a legacy.
Yeah.
That is so cool.
Yeah.
Well educated too. My gosh, what a hard course to go back to uni and do.
I'm doing my PhD at the moment, and I'm doing it on street art and its impact on mental health and wellbeing in Toowoomba. And it's street art, like the murals. We've got over 80 murals. And I know that when I had that incident with my back, I went and looked at murals, and it made me feel better, and when I was very confused about what I was doing with my life. And I thought, well, if it makes me feel good, I wonder if it makes others feel good. So we're going to be developing, I'm doing it through UniSQ with 2 amazing supervisors, and we're going to co-design some street art walking maps and then use it so people can go and travel around and get exercise and work on their well-being while looking at beautiful art. We're going to see if that makes a difference.
That is incredible and such a good thing for the community too, as a byproduct of helping people.
Yeah, well, hopefully at the Flower Festival, time, people can get these maps and actually do a little bit more exercise, which is one of our 5 ways to well-being, being active. And being aware and learning new things, because we'll have a QR code on them which talks about the artist and what inspired them, and it might inspire other people.
That is awesome.
Yeah.
I love that so much.
Yeah.
So what else is Momentum Mental Health doing in the community currently?
Oh, gosh, we are super duper busy, which is awesome. So we have sites in Chinchilla, and then from there they go to Miles and Tara. We do Dalby, Kingaroy and Warwick, as well as Toowoomba. And so we've got all these different sites where people can come, and we do group programs. So we do like cooking, we do gardening, we do art therapy, journaling. Anyone can come. Then fill in the paperwork and it's 100% free. The thing that I'm most excited about Momentum is we partnered with Mindware Psychology last year. Mindware Psychology are amazing. They're doing bulk billed clinical psychology for free with no out-of-pocket. Unfortunately, we do have now a waiting list of 200 people because nobody bulk bills really. So we've created this amazing demand, but that's the other thing we do. So while people are waiting for their clinical psychology, they can come and get our support from our wellbeing coaches and come to an art therapy session or do cooking, and that's where all our fundraising goes to, helping us ensure everything's free and that we can offer anyone who wants to come and work on connection can come and just hang out with other people or make some new friends or, learn a new skill.
That is so cool.
Yeah.
Yeah. It sounds like you guys are doing a fantastic job and really getting the community up and active. Yeah,
I'm really proud of the team. They are just outstanding, genuinely care. And we did a survey last year on number one strengths of the team. Mine was appreciation of beauty. Mine was not kindness, but everyone else, their number one strength was kindness. And I was like, well, that's okay because they're the ones on the ground doing the doing. So I was really proud that the number one strength was kindness because that's one of our values as well. And we've got a really diverse group of members who come, but also our staff members are all diverse and many of them with a lived experience themselves, which makes a difference. So a lot of them have childhood trauma, sexual assault experience or domestic violence or a mental health condition. And so it means they're very relatable with the people that come in. But it's such an awesome team. And then we've got an amazing board, and Chris Black, we're very fortunate to have him as a board chair. He is a superstar just in the business world. And I always joke with him because I'm well known in the community world, he's well known in the business world, and he's just a superstar philanthropic legend. That's how I describe him.
That's lovely. Yeah, Chris is a good man. So for anyone listening to this, how can they get behind what you're doing and support you guys?
If they are suffering or experiencing poor mental wellbeing, they can drop into 112 Russell Street or go on our website where they can see all of our programs for the month and they can come along. If they'd just like to support us so that we can continue to have free services, then they can go to our website, which is www.momentummentalhealth.com.au, and you can donate on our website. Just come and if you see us at a community event, come along, but we have to fundraise around $200,000 a year to keep all our services free. So it would be good if people could come and, donate, see what we do. We do hold an open house on the first Thursday of every month from 12 till 1, where anyone can just rock on up to sort of see what we do and come along and have a look at our location. And that's free, and you get free lunch and, just come and chat.
Yeah, that is awesome. To do what you do, and to require only $200,000 of funding to keep your services free and impact that many lives is incredible. So it shows incredible financial prudence from the board and the operators within the business. That's fantastic. Yeah.
Well, we do get the government funding, which doesn't cover it all, which is why we've got the $200,000. But yes, I can't believe we're up on activity 55% in attendances this year because we're just you get out there and people find out about you. But it's really cool. And like I said, it's the best job I've ever had, so rewarding. And and to make a difference to people who need it, it's really nice.
That's awesome. Now, I saw that you guys are heading over to Kokoda What's
Yeah.
that all about?
Oh, yeah. So amazing Chris Black, our board chair, he in 2023 climbed Everest to fundraise for us, and that meant we could have a wellbeing coach for a year to help support the team. This year, he decided to go and do Kokoda. So he has 20 trekkers that are going to spend 10 days in Papua New Guinea trekking the Kokoda trek, which isn't my cup of tea, but I'm so pleased that they're doing it, with the goal of trying to fundraise $300,000 for us, which would be incredible. And so they're going in June, so there's plenty of time if people want to get behind that. And we were lucky enough to have an amazingly generous community member sponsor one of the trekkers who couldn't afford to go themselves. And so we've got 19 paid trekkers and our bursary trekker as well. So 20 of them going for 10 days, something like 93 kilometres or something. It sounds like it's pretty full on. Yeah, all to raise money for Momentum, which is cool. And 100% of the funds are going to come to us, which we're super excited about.
That is awesome.
Yeah.
Well, thank you so much for your time today. It
Thanks.
was brilliant to be able to talk to you and hear about all the stuff Momentum Mental Health is doing in the community. Thank you so much for your service.
Thanks.